Welcome to the Bahamas Medical Center, located in beautiful Nassau, Bahamas. The Bahamas Medical Center is a center for international medical excellence associated with Doctors Hospital, a recognized JCI accredited hospital that has been caring for local and international patients since 1955. Our team of top specialists offers outstanding dental care, plastic surgery, bariatric surgery, anti-aging services, women's health services, orthopedic surgery, and so much more. We invite you to learn more about Bahamas Medical Center and our excellent bariatric surgery weight loss program.
I'm Dr. Charles Digges. I am a general surgeon. I've been in practice since 1989, and I've been involved with bariatric surgery since 2008. Well, bariatric surgery in the Bahamas has an interesting history. If you go back to the 90s, late 90s, when the introduction of it occurred, it really occurred because of an interest in moving into the laparoscopic approach to bariatric surgery. So my introduction was through the creator of the lap band, Professor Belichev, and with the president of the American Society of Bariatric Surgery. They both came to the Bahamas and they met me and they said, well, listen, you do laparoscopic general surgery. Would you be interested in switching into bariatrics or looking at the lap band? And tied to that was a trip to Belgium and some other stuff. And I said, fine, let's take a look at that. So my interest was the pioneering interest in bariatrics. Up until that point, there was no one surgeon committed to or involved with the practice of bariatric surgery in the country. And so most patients, if they had the procedure done, would have traveled. If you have comorbidities like diabetes, hypertension, metabolic syndrome, any issues like that that are well controlled, then being motivated with controlled comorbidities at a BMI of around 40, having failed a number of weight loss efforts in the past, not having had prior bariatric surgery would help. That's an ideal patient, somebody who's really motivated and interested, keen to lose the weight and want to get into a sustained weight loss zone.
My name's Jessica Robertson. I was 38 years old. I had struggled with weight all my life, tried just about everything to lose weight, had some success, limited success. I had to go to extremes in order to achieve that success and had pretty much given up with all of the known methods out there. And one day my dad came home and he said, have you ever thought about trying lap band? And I'd given no real thought to surgery. At that time I only knew about bypass, and it was a bit extreme for me. But he told me that one of the doctors here, Dr. Digges, was now offering this procedure and was having some success with it, and thought maybe I should look into it. So I went home and I researched, as I do everything. And by the time I went into his office to meet with his team, I pretty much knew everything I needed to know that I was willing to explore this as a potential procedure for myself. But I also knew the questions that I needed answers to. And I knew the answers that I needed to hear to be comfortable that they had the right kind of program and that he was the right surgeon for me.
You know, bariatric surgery is a very serious decision for patients who have tried a whole number of efforts, and sometimes throughout a lifetime. These are exasperated, frustrated, and sometimes desperate people, and sometimes vulnerable people. And what we want them to understand is that they're coming into an environment where all of the usual standards, all of the traditional and acceptable medical practices exist. The issue of the Joint Commission accreditation is one that we can't emphasize enough. Simply to say it's that good housekeeping stamp of approval that says, you know, we're going to adhere to a certain way of conduct, both in business, in the practice of medicine, in the focus on safety. We intend to make this experience certainly as elegant, as aesthetic, and as safe as possible for all the patients. We believe that this is certainly a decision that you could make with great comfort. We invite you to come, check us out, visit the facility, meet us. We don't claim to be perfect, but we claim that we will certainly be a perfect formula for you and your journey in getting a sustained surgical solution for your obesity.
The Bahamas has it all. leading healthcare specialists, world-class resorts, stunning beaches, international dining, shopping, spa treatments, and the kind of personal care and attention that makes you feel completely at home, even when you're away from home. What are you waiting for? Better weather, better healthcare, and better prices await you.
Come, get better in the Bahamas.